the studio this afternoon by the Narcotics Control Commission here to talk about the International Day Against Drug Abuse and Illicit Trafficking. That day is always set aside annually by the United Nations General Assembly resolution of December 7, 1987, for member states to raise awareness of the risks and effects of drug abuse and illicit drug trafficking, as well as to consider the most effective countermeasures. It also serves as some motivational factors to increase action and collaboration in order to realize the objective of a global civilization free from drug usage. Joining us now is Kamaldeen Awudu. He's the head of Education and Prevention Department of the Narcotics Control Commission. Thank you, sir, for spending some time with us. Also joining us via Zoom is Dr. Joel Goringa. He's a psychiatrist at the Accra Psychiatric Hospital. They are all joining us today. Thank you, sir, for your time. Of course, Ghana's positioning is very much critical in the eye of the world as to what we're doing critically to tackle these issues of illicit drug trafficking and all of that. What do you have to say about where we find ourselves as a nation in terms of fighting these illicit drug trade?
Yes, what I can say is that, let me say a good evening to your viewers. What I can say is that the Narcotics Control Commission and Ghana, for that matter, we are on course in the fight against drug abuse and drug trafficking. Of course, I come from the Education and Prevention Department. I'm the head of the department. And I can tell you that we are doing a lot of work in the schools, especially when it has to do with prevention. That one has to tackle the youth. They are the most vulnerable in terms of drug abuse and illicit trafficking globally. And so we are doing a lot in terms of prevention, education, and then we're also doing a lot when it comes to treatment and rehabilitation. And so we are doing a lot. And then when it comes to the enforcement aspect, if you want me to add about enforcement, we are also doing a lot, in the borders, the entry and exit points. And so I can see that we are doing a lot in terms of fighting the drug menace. And
very often, the most traded within, as some would argue, is the issue about cannabis and its usage here in Ghana. Is it? We know what the position of the law is, but very recently there was another ruling by the Supreme Court. What's the position of the Narcotics Control Commission on this recent decision that has been made, and what should the public be aware of, given this very recent decision?
Yes, I wish we don't delve into this issue of, as it stands now. Yeah. The Section 43 has been struck out of the law, and so there can be no conversation can be had in relation to that. And I think that
so it remains illegal.
It remains illegal as far as we are concerned. It remains illegal, and the usage, the possession, cultivation, and so on are all illegal.
What would you want the public to know about your activities and some of the steps you're taking to ensure that compliance is key? Because even as we speak, you still intercept some of these packages across the country. You carried out some exercises a few weeks ago, and many are wondering why we still have these cases persisting in the country.
Well, we like I said in my preamble, we are doing a lot in terms of fighting the drug menace. But as you know, we can't do all. We collaborate with other security agencies to ensure that these objectives of the organization are achieved. And I can say that we are doing a lot in terms of trying to ensure that drugs do not come to the country and drugs do not go out of the country. We are also ensuring in terms of demand reduction to reduce the demand that people have for illicit drug use in our communities. And we are on course in doing that. So that's what I can see for now.
Doc, let me bring you in. The impact of the usage of these drugs on the general public is something that we must pay attention to. You agree?
Hello, good evening, and thank you for having me. Good evening to your listeners. Yes, I do agree that the drug abuse menace has certain challenges that requires a holistic view. From the clinical point of view, the scenarios and the situations that we see, the impact that people who have addictions to various substances of abuse are going through need that we should have a second look at it, because for most people, once they get hooked on certain substances of abuse, productivity goes down the line. And for a person need to have a social life, need to have an occupational life, need to be able to work with your family. Drugs of abuse can literally take over your life and make sure that your life revolves around just the substance and you are not able to perform any other functions. And that can be quite disturbing, especially because most of the people that are suffering from these conditions are likely to be in their productive years. And so it's important that we have a holistic approach to addressing this issue.
This is also common amongst the youthful population. The addictive nature of it, what's the science behind all of this, first of all?
Yes. I think what I want to emphasize here is that addiction is a disease of the brain. And we know this because we've done several studies looking at the brain structure of people who have addictions. And we can see that when people use certain substances for a prolonged period of time, it's able to change the architecture of the brain in such a way that it keeps them using the substance, even when there's evidence that there is harm to the person, either in their physical health or their social and economic life. So one of the most common and oldest conception of addiction has been the moral misconduct theory, that people think that people who have addictions are willfully doing what they are doing. So they are sinners. They may be attributed even to spiritual forces. And so we have tried to use unsuccessfully, I must say, punishment as a way to curb, addiction. But we know that it has never worked because you can't use punishment to fight biology. And so addiction is a disease, just like any other disease that can affect any part of the human body. And addiction is a disease that affects the brain.
Doc, thank you so much for joining us here on The Pulse. I'm grateful. Let's deal with the aspect about the trade itself of the drugs within the country.
The trade?
The illicit trade, I should say. What is the law saying about it, and what do we need to know about the position of the law on that?
Yes, the position of the law in terms of the trade is that it is illegal. Any engagement in any illicit business in relation to anything that has to do with narcotics, it's illegal. And there are penalties for that when you contravene the law. And when you go to the section that has the table for the penalties and offenses, you see all the penalties spelled out clearly.
Are you able to share some of the?
Yes, if you don't mind. If I can.
Yeah. So while we get to we have some of them there.
So when you go to section 36 and 40 of the Act, the Narcotics Control Commission Act, it spells out clearly that the importation, exportation of narcotics or plants which is bringing in or taking out narcotics or plant across the borders is illegal.
Right.
And then if you go to sections 37 and 40, it also spells out clearly that unlawful possession is also, against the law. And then engaging in that prohibited business, like I said earlier, is also illegal. So when you go to sections 38 and 42, it also spells out clearly that when you engage in any prohibited business in relation to narcotics, it is also illegal. So clearly, the law spells out clearly that when you engage in any of these acts, it is clearly against the law. And then finally, cultivation. I don't know if you are minded to. Cultivation of any plants, is also against the law. And that one is also clearly spelled out in section 39 of the Narcotics Control Commission Act 1019. And so clearly, engaging anything in relation to this is also against the law. So that's the position of
we're about wrapping up, and as we wrap up, the entry points, the border checks, how are you enhancing that, and what would you want the general public to know as we celebrate or mark this day?
Well, I think in my introduction I mentioned that we find our officers in all the entry and exit points. And I've been an operative in the Narcotics Control Airport for about 7 years.
Right.
And so work is ongoing, and officers are there working day in and day out to ensure that nobody brings in drugs and nobody also takes out drugs. And so the fight is on. But if you are minded, let me just let you know that we are celebrating the World Drugs Day activities starting from 26th.
26th, actually, okay, right.
So it's a year-long program.
A program that you're running.
We are running. And so, every year on the 26th of June, this day is commemorated, globally. And the reason why it is done is to, create the awareness that illicit drugs cause a major threat to our societies. And so during this time, communities all around the world come together, groups, just to create the awareness that drugs are a threat to our societies. And then let me also please talk about, the role of parents.
Right.
I come from the Education and Prevention Department. And then, as the saying goes, prevention is better than cure. And so I have a bias when it comes to that. And so when it comes to the prevention aspect, the children, your child and my child, are the ones on the line. And they are the ones who are the most vulnerable because they are not matured enough, to make decisions for themselves. So this is the time that as parents, we have to listen to them. When they come to us with their issues, don't say you are busy. We are all in the city, we are all running around, looking for something for our daily bread. But we should also have time for our children because it is they start introducing them at this age, and at this age, because their minds are not matured, they are so susceptible to addiction. And when they become addicted to their drugs, the man on the market side, the supply side, has a ready market. Right. And so all of us should pay attention to our children, leave very good examples for our children to copy, because children don't listen to what we see; they copy what we do. And then also when it comes to addiction. Now, like my counterpart online said, addiction is now considered as a public health issue. And we as from Narcotics Control Commission is considering people who are using drugs as people who are just as anybody who is sick. And so what they need is our support. Right. It's not to treat them as if they are. That's why the World Drug Day
is being set aside.
Yes, the theme is stop the stigma and discrimination against people who are...
I wish this conversation would have gone on, but unfortunately we're running out of time. We'll spend some time on the day when, of course, you're celebrating this, so we can talk about this. Right. Thank you so much for spending some time with that.